Hi, I'm Michael Nusimow, CEO and co-founder of DrChrono. I'm a graduate of SUNY at Stony Brook University on Long Island, and that's actually where I met my co-founder, Dan Kivitinos. We were actually roommates and classmates at Stony Brook University, where we both studied computer science, and we've actually been best friends for the last 15 years. Kind of the story of how we got into this space, we're both software developers. We're both really interested in eventually starting our own software company. But what got me personally very interested in healthcare is about 4.5, 5 years ago, my father had actually become quite ill. And I was helping him go to a lot of doctor's offices and a lot of specialist visits for his ongoing medical issues. What I found is when we actually went to doctor's offices, they would have a thick manila folder filled with hundreds of sheets of paper, some faxes, lots of scraps of paper. And so in a 20-minute visit, which is all the time you really get with your doctor, they would spend the majority of it just kind of looking through his med list, trying to figure out what was going on. And that's kind of what inspired me to really get into the healthcare space, was just this personal experience of seeing at the low end, the majority of ambulatory care doctors outside of hospitals don't have clinical tools to help them at all. And at the higher end, the tools that hospitals are using suffer from a very common problem in enterprise software where the doctors and patients are much lower order customers than, say, the IT team in the hospital. So the tools are very disengaging for the people who are actually using them. So having experienced these problems in the healthcare industry myself while helping my father through his illness, it really inspired me to start a company where we'd really focus on improving the technology and making it accessible for the average doctor to start using when they're treating their patients. At DrChrono, we're building mobile applications for healthcare that connect the doctors with their patients. So we offer a free product right in the iTunes App Store that any doctor can download directly to their iPad or iPhone. And this is a product that's fully certified to meet the government's High Tech Act's meaningful use requirement, which allows a doctor, just from using our free app, to earn $44,000 in meaningful use incentives. So pretty much every doctor in America now realizes they're going to have to be using an electronic health record within the next few years. And DrChrono, just with our free version, helps them meet that requirement. And once they start engaging with the electronic health record, they can upgrade their plan to a paid feature that will take over all of their medical billing, all of their back office work that is often done at much more expensive price points and very inefficiently on paper. And even building on that for the future, we've launched our on-patient personal health record app. So any patient in the world can download this app and use it to record their personal health information and send it to your doctor. And often these tools are really powerful for helping people manage their health, but they're also replacing really expensive doctor visits. The average follow-up time and cost for someone who's had heart surgery is 10 in-office visits that will cost anywhere between $40,000 and $50,000 in total. Using these remote monitoring devices could let a patient displace half of those visits. The patient doesn't have to go all the way in to see their doctor, and every other visit could be a remote visit at a fraction of the cost and much more convenient for the patient. So DrChrono is targeting small ambulatory private practices in the United States. There are 1 million ambulatory physicians in the United States, and 80% of all the ambulatory care given in the US is done in small private practices of groups in size 1 to 10 physicians. So that's the market we're targeting. We're really looking to get the 1-2 doctor physician practices all the way up to physician practices with 25 doctors in a single group. And that's the majority of the healthcare given in the US. There's no clear leaders in the space who have runaway market share of 50% plus. So it's a very blue ocean market. And even looking at the initial EHR adoption numbers, the majority of physicians who've adopted an EHR are unhappy with the system and are looking to change. And the average age of a doctor who's in the ambulatory space using an EHR is somewhere between 3 and 6 months. So it's a very fluid space. It's a very young space with no dominant players. And there's a lot of small companies that are just emerging. At DrChrono, we've been working on our iPad electronic health record for the last 3 years. So we're the most advanced mobile EHR on the market. We have over 40,000 physicians who are using the free DrChrono iPad EHR that's certified for meaningful use. We have over 1.7 million patients under the care of those doctors using the iPad electronic health record. Just in December of 2012, we launched DrChrono's on-patient PHR, which is a different branding, which any patient in the US or even in the world can download to start putting their health record information in. And it's just a brand new product, and we want to build out a new engineering team just separated completely from the engineers building out the tools for doctors. We're able to just focus on building really compelling tools just for patients. And there's a very powerful synergy between the two, because the doctors will send their patients to on-patient, and patients engaging with on-patient can share that data, with doctors using DrChrono, but they are two completely separate products, and it'd be really powerful to have a product team just focused on building out patient tools. So in the last 4 years, I'm really proud of what DrChrono has been able to accomplish. We've added tens of thousands of doctors onto the DrChrono electronic health record platform, and we've treated millions of patients through onpatient.com and the OnPatient app. And I'm really proud of that accomplishment. I think our ambition is to really put these great tools in the hands of everyone.